probably heard of Kegel exercises, but did you know they aren't just for women? For men, they can be a complete game changer. I'm Dr. Evelyn Hartwell, a urologist and pelvic surgeon, and today we're diving deep into Kegel exercises specifically for men. If you've ever wanted to improve your bladder control, support your prostate health, or even turn up the heat in the bedroom, you're in exactly the right place. In this video, we're going to explore what Kegels are, why the science shows they work, who they're great for, and just as importantly, who should skip them. Plus, I've brought in an expert on the subject, pelvic floor physical therapist Eric Leckie. He's going to give you a step-by-step masterclass on how to perform a Kegel correctly. So, what exactly are Kegel exercises? I want you to picture your pelvic floor as a muscular hammock, a strong, supportive bowl stretching from your tailbone in the back to your pubic bone in the front. This group of muscles, particularly the pubococcygeus or PC muscle, is incredibly important. It supports your bladder, prostate, and rectum. It's essential for your ability to urinate and hold in stool. It plays a key role in sexual function, and it's even a vital part of your core, contributing to your overall stability and everyday function. Kegel exercises are simple, targeted movements designed to strengthen this muscular hammock. They were named after Dr. Arnold Kegel, who first introduced them back in 1948 as a way for women to address urinary leakage after childbirth. However, we now know they are just as crucial for men. Over time, factors like aging, prostate surgery, or conditions like diabetes can cause these muscles to weaken. This weakening can lead to frustrating issues like urinary leakage and sexual problems. But do these exercises actually work for men? The good news is absolutely, and the science backs it up. Several studies have confirmed the effectiveness of Kegels for men's health issues. For instance, a 2005 randomized controlled trial looked at the role of pelvic floor exercises in restoring erectile function. The study involved 55 men with ED. One group received guided pelvic floor exercises, enhanced with biofeedback, which uses patches to show you how strongly your muscles are contracting, while the control group was simply given lifestyle advice. The results were striking. After just 3 months, the group doing the exercises showed significantly better improvements in erectile function. And after 6 months, an incredible 40% of them had regained normal function. As a bonus, they also saw a major improvement in post-void dribble, that little bit of leakage that can happen after you urinate. Now, there's an important lesson here. The study did have a high dropout rate of about 40%. This highlights a critical point. Kegels are just like any other exercise. You have to stick with them consistently for them to work. It can feel time-intensive, and if you don't see immediate results, it's easy to get discouraged and give up. But just like building your biceps, some muscles take more work than others, especially if they are very weak to begin with. This is something you have to commit to if you want to see real, lasting improvement. Let me share another study. A 2019 systematic review by Myers and Smith analyzed 10 different studies and found that, generally speaking, Kegels improved both erectile dysfunction and premature ejaculation. For ED, all 5 trials they looked at showed improvement, with some studies reporting cure rates as high as 47%, especially when combined with biofeedback or muscle stimulation. In terms of premature ejaculation, the results were equally impressive. One study reported that 55% of men, that's 43 out of 78 participants, completely resolved their premature ejaculation. Another study with 40 men saw their average ejaculation time skyrocket from about 39 seconds to over 146 seconds. As a urologist, one of the most common times I prescribe these exercises is after a prostatectomy, the surgical removal of the prostate. Some men develop stress urinary incontinence after the surgery, meaning they leak urine when they cough, sneeze, or lift something heavy. Multiple studies have confirmed that performing these exercises significantly decreases the amount of leakage over a 24-hour period. And the research is clear. Doing them with a certified pelvic floor physical therapist, like having a personal trainer at the gym, yields the best results. Finally, while the scientific evidence is still emerging, many men report that Kegels help with orgasmic intensity. This makes intuitive sense. When you climax, your pelvic floor muscles contract rhythmically. If those muscles are stronger, they can contract more powerfully, potentially leading to a more powerful and satisfying climax. So, who are these exercises good for? They are fantastic for men dealing with erectile dysfunction, premature ejaculation, urinary leakage, or other issues following a prostatectomy. But before my expert colleague Eric teaches you the how-to, it's crucial to talk about who shouldn't do Kegels, or at least who should proceed with caution. First and foremost, if you have pelvic floor dysfunction, you need to be careful. How would you know? If you experience chronic pain in your genitals or pelvic area, pain with orgasm, ejaculation or erection, chronic constipation, or significant urinary issues like constant frequency and urgency, I strongly recommend getting evaluated by a doctor first. Starting Kegels on your own could make these issues worse. Also, if you've had recent surgery or have an active urinary tract infection, hold off until you get clearance from your doctor and the UTI has fully resolved. And now, I'm excited to hand it over to Eric Leckie to guide you through the exercise itself. Hi everyone, my name is Eric Leckie. I'm a pelvic floor physical therapist, a fellow YouTuber, and I help guys just like you get rock hard and stay leak-free. Today, I'm going to teach you exactly how I coach my clients through a proper pelvic floor contraction, also known as a Kegel exercise. First things first, we need to understand the muscle group we're actually trying to strengthen. For a lot of us guys, we didn't even realize we had a pelvic floor. So excuse the visual, but we need to get specific. We're focusing on the muscle group located in your perineum. That's the area of tissue between your scrotum and your anus. If you lift your scrotum, you'll find that spongy area right there. That's the muscle group we want to strengthen to achieve strong erections and stop urine dribble. This is also the area we need to feel or palpate to make sure we're doing the exercise correctly. If you don't know what to feel, where to feel, and how much to feel, you can't be certain you're actually working the right muscles. So, how do we know what to feel? I want you to take 2 fingers on your dominant hand, your index and middle finger, like you're about to take your pulse. We're not taking a pulse today, but we're going to use these fingers to feel our perineum. If you're sitting down on a couch or an office chair, I want you to scoot all the way to the front, so your scrotum and penis are hanging off the edge. Only your sit bones should be in contact with the chair. Next, lift your scrotum and place those 2 fingers directly on your perineum, just pressing up gently. You don't need to dig in, just hold them there. Good. Now, place your free hand on your knee and just relax. Take a deep breath in and out. Okay, we're ready to go. You're probably wondering why you have 2 fingers down there. Well, what you're feeling for is either a subtle bulging out into your fingers or a tightening of the skin underneath them. If you can feel anything moving at all under those 2 fingers, you are successfully contracting your pelvic floor. That's our goal. If you can't feel it yet, that's okay. Don't worry. It just takes a little practice, but having your fingers there is the best way to make sure you're doing it properly. So, with 2 fingers in place, your free hand on your knee, sitting upright with your feet shoulder width apart on the floor, we're going to use a mental cue to trigger the muscle contraction. Remember, we can't see these muscles like our biceps, so we need to focus. The first phrase is this. I want you to imagine you're standing at a urinal and you need to suddenly stop the flow of urine. So watch me first. You're going to close your eyes, breathe in deeply, and then breathe all the way out. Once all the air is out of your lungs, mentally stop the flow of urine. Then immediately let it go and relax. Let's try it. Breathe in, breathe out, get all the air out, and now stop the flow. Relax. You should feel a little flicker, a bulge, or a tightening under your fingertips. For those of you just starting out, it's perfectly fine if that contraction felt weak. These muscles need strengthening. That's why you're here. Over time, you'll feel that contraction get stronger and stronger. If you didn't feel it at all, I have one more phrase that often works well. This time, I want you to imagine you're walking into a freezing cold ocean. As soon as your scrotum hits that icy water, you get that feeling where your genitals seem to suck up into your stomach. That's the sensation I want you to replicate. Let's try it. Fingers on the perineum, hand on your knee, sitting up tall. Big breath in and a big breath out. Once the air is all out, say to yourself, lift your nuts to your guts. And then let it go. One more time. Big breath in, big breath out. Lift your nuts to your guts and let it go. It should feel like everything moves up and in and then fully releases. I love the cues Eric just gave you. Here's one more way I like to help guys visualize it. Imagine you're trying to lift your penis off the ground without touching it, or that you're trying to hold in a fart. The most important thing is to make sure you're not clenching your butt muscles or your abdominal muscles. You want to isolate those pelvic floor muscles. I also suggest starting these exercises lying down so you can really focus without activating other muscles. Once you get good at that, you can progress to doing them while sitting and eventually while standing. Now, what I like to get my guys started with is doing a set of 10 of these while sitting down. That's 10 breathing cycles. Breathe in, breathe out, and then either stop the flow or lift your nuts to your guts. Then immediately relax. It's like flicking a light switch. Flick it on, flick it off. Do not hold the contraction just yet. You're not ready for it. And if you try to do too much too soon, you can actually tense up the pelvic floor, which is counterproductive. So let's start slow. Close your eyes and focus on quality, not quantity. Keep your fingers on your perineum every single time to ensure you're getting quality reps. I have a ton of videos on how to progress your exercises over on my YouTube channel. Final thought. Strengthening your pelvic floor can be a frustrating experience at first. You need to cut yourself some slack. Breathe, be patient, and dedicate a small amount of time every single day to your Kegels. I recommend starting with just 30 reps a day, 10 quick flick on, flick off reps in the morning, 10 in the afternoon, and 10 at night, all while sitting. You'll know you're ready to progress when you can really feel that strong engagement and then a complete release. It takes time. A lot of us men want to rush this process, but with the pelvic floor, that's just not an option. Be patient with yourself. So, let's bring it all together. We've learned that your pelvic floor is a hidden powerhouse, essential for bladder control, sexual health, and core stability. We've seen the scientific proof that strengthening it works, and you've received a step-by-step masterclass from an expert. The journey starts with a single, mindful contraction. It's not about brute force, it's about connection and control. Think of this as laying a new foundation for your health. Stronger bladder control means more freedom and confidence. Enhanced sexual function can deepen intimacy and satisfaction. A stable core supports every move you make. This isn't just an exercise, it's a skill that integrates into a healthier, more vibrant life. Remember Eric's advice, be patient. You wouldn't expect to have massive biceps after one day at the gym. Grant your pelvic floor the same respect and time. The small, consistent effort you put in each day will compound over weeks and months, leading to results that you can truly feel. A huge thank you to Eric for joining our channel and sharing his expertise. If you want to learn more from him, please check out his YouTube channel. And guys, if you haven't subscribed to this channel yet, I don't know what you're waiting for. It's completely free. Hit that subscribe button. And as always, take care of yourself because you're worth it.